Measles is one of the most, if not the most, contagious disease known to us, and it has been making a comeback in the United States. With measles, a single person can spread the infection to somewhere between 12 to 18 other people in a population where no one else has immunity. So if we pick a number that's in the middle of that range, say 15, and play that out, you have one person with measles infecting another 15, and each of those 15 people could then infect another 15. So very quickly, these numbers multiply very fast and the number of cases can just explode. So if you think of something like the flu, where a single infected person infects between 1 and 2 other people. To stop the exponential growth, you need to vaccinate about 50% of people. When you do that, you can see how you eventually get to a point where the exponential growth slows down and stops. So now let's see what happens with a much more contagious disease like measles. If 50% of people are vaccinated, well, that's not enough to stop the spread of measles. To stop the exponential growth, you need to vaccinate about 14 out of 15 people. That's where we get this idea of the herd immunity threshold for measles, where federal guidelines recommend that about 95% of people should be vaccinated against measles to stop the exponential spread. In the past, US vaccination rates among kindergartners were hovering around this 95% rate. But since 2019, they've dipped below that line. And now, most kindergartners in the US live in states where vaccination levels are below the threshold for herd immunity. When enough people are vaccinated, it's not just people who are vaccinated who are protected, it's also unvaccinated people. And that includes babies, infants who have not yet had their first vaccine shots as yet, and it includes people with weakened immune systems who are not able to get vaccinated. What herd immunity buys us is community protection for everyone through vaccination.